Muscles of mastication. Masticatory muscles are concerned with the movement of mandible at the temporomandibular joint. These are located in and around the infratemporal fossa, and these muscles are inserted into the ramus of mandible, and all these muscles are innervated by the mandibular division of trigeminal nerve, and all these muscles that is supplied by the mesoderm of first pharyngeal arch. The next one, the principal muscles of mastication. The first muscle, that is the temporalis muscle. This muscle located in the temporal fossa, but its tendon of insertion is in the infratemporal fossa. Then the second muscle, that is the masseter muscle, that is located to the ramus of mandible and is the most superficial of the four muscles of mastication. The third one, lateral pterygoid muscle, it is in the infratemporal fossa, and the fourth one, that is the medial pterygoid muscle, that is also in the infratemporal fossa. They all act on the infratemporal, that is the temporomandibular joint, and move the mandible in the acts of mastication and speech. The next one, that is the accessory muscle. The first one, that is the digastric muscle. Second one, that is the buccinator. It is regarding as the accessory muscles of mastication. And third one, that is the mylohyoid, and the fourth one, that is the geniohyoid. Then we will discuss about these muscles of mastication. That's the principal muscles of mastication. That's the four muscles: temporalis, masseter, lateral pterygoid, and medial pterygoid. All these muscles have origin, insertion, nerve supply, action, and some muscles have their own relations are there. The first we will discuss about the temporalis muscle. The temporalis muscle, it is a fan-shaped muscle that is in the temporal fossa. It is covered by a rough temporal fascia. The temporal fascia is attached above to the superior temporal line and below by the two layers to the lateral and medial lips of the upper margin of the zygomatic arch. Then on the origin of the temporalis muscle. The temporalis muscle, that is origin from the entire floor of the temporal fossa and the inner surface of the temporal fascia. The floor of temporal fossa, that including outer surface of frontal bone, parietal bone, entire part of the squamous part of temporal bone, and the greater wing of the sphenoid. The floor of temporal fossa that we can see in the norma lateralis. The next one, that is the direction of muscle fibers of temporalis. The first one, that is the anterior fibers that run vertically downward to converge in the tendon. The second one, that is the middle fibers, run obliquely to converge in the tendon. The third one is the posterior fibers that run horizontally forward to converge into the tendon. The next one, insertion of temporalis muscle. The tendon of temporalis is inserted into the medial surface and the anterior margin of the coronoid process and anterior margin of the ramus of mandible. Then action, the anterior vertical fibers and the middle fibers that causes the elevation of mandible, that helping in the closure of mouth. The posterior horizontal fibers are responsible for the retraction of protruded mandible. Then nerve supply. The temporalis is supplied by the deep temporal nerve, that is a branch of anterior division of mandibular nerve. So that's all about the temporalis muscle. Then next move on the next muscle, that is the masseter. It is a thick quadrilateral muscle that is placed superficial to the ramus of the mandible. It can be palpated in the living on clenching the teeth. The pulsation of the facial artery are felt at the antero-inferior angle of the masseter. The next one, origin. The masseter consists of 3 layers depending on the origin. The first one, that is the superficial layer, is the largest and it is originating from the maxillary process of zygomatic bone and anterior 2/3 of the lower margin of the zygomatic arch. There are intramuscular tendinous septa in this layer of the muscle. The second one, that is the middle layer, that is originating from the lower margin of the posterior 1/3 of the zygomatic arch. The third one, that is the deeper layer, that is originating from the deep surface of the zygomatic arch. That's all about the origin of the masseter. The next one, insertion. The 3 layers are inserted into the lateral surface of the ramus of the mandible at 3 different places. The superficial fibers are inserted into the angle and adjacent posterior part of the ramus of the mandible. The middle fibers are inserted into the intermediate part of the ramus of the mandible, and the deep fibers are inserted into the upper part of the ramus of the mandible and the coronoid process of the mandible. And this masseter muscle have some relation. The parotid duct and branches of facial nerve that process the masseter superficially. The posterior part of its superficial surface is contact with the anteromedial surface of parotid gland. The buccal pad of fat separate its anterior border from the buccinator muscle. The last relation, it is covered with parotidomasseteric fascia, which is the extension of deep fascia of the neck in the face. The next one, nerve supply. The masseter is supplied by masseteric nerve, that is the anterior division of mandibular nerve. The last one, action. The masseter elevates the mandible and it is responsible for occluding the teeth to take a forceful bite. So that's all about the masseter muscle. The next one, that is the lateral pterygoid muscle. It is roughly triangular in shape with the base, that is the origin, that is directed anteriorly. Then apex, that is the insertion, that is on posteriorly, and it is a short muscle. It have a 2 head, the smaller upper head and a larger lower head. The next one, that is the origin of lateral pterygoid muscle. The lateral pterygoid muscle that have a 2 head. The upper head, that is arising from the infratemporal surface and infratemporal crest of greater wing of sphenoid. The lower head arising from the lateral surface of the lateral pterygoid plate. That's all about the origin. Next one, insertion. It is inserted into the pterygoid fovea on the anterior aspect of the neck of the mandible and in the articular disc and the fibrous capsule of the temporomandibular joint. Then nerve supply. The lateral pterygoid muscle, that is supplied by nerve to lateral pterygoid, that is an anterior division of mandibular nerve. Then action. The most important action of the lateral pterygoid muscle of the 2 side is the depression of mandible that causes the opening of mouth. The protrusion is by simultaneous action of lateral and medial pterygoid of both sides. The lateral and the medial pterygoid muscle of the 2 sides contract alternately to produce side-to-side movement of mandible as in grinding or chewing of the food. The next one, that is the relation of lateral pterygoid muscle. The structures that emerging from the upper margin of the lateral pterygoid muscle. The structures related to the upper margin of the lateral pterygoid muscles are the 2 deep temporal nerve and masseteric nerve with accompanying vessels. Deep temporal nerve and vessels, masseteric nerve and vessels that is emerging on the upper margin of the lateral pterygoid muscle. The next one, the structures passing between the upper and the lower head of the lateral pterygoid muscle. The structures are buccal nerve, maxillary artery that enters to become the third part. The next one, the structures related to the lower margin of the lateral pterygoid muscle. The structures are lingual nerve emerges, inferior alveolar nerve emerges, inferior alveolar vessels are emerges, the first part of maxillary artery that along the lower margin of the lateral pterygoid muscle, then middle meningeal artery and accessory middle meningeal artery that passes upward and deep to the lower margin. That's all about the three relations of the lateral pterygoid muscle. The next one, that is the deeper relation of lateral pterygoid muscle. The deeper aspect of the lateral pterygoid muscle is related by mandibular nerve, middle meningeal artery, then sphenomandibular ligament. Sphenomandibular ligament and the deep head of the medial pterygoid muscle. That's all about the deep relation. Then the last one, the superficial relations. The superficial surface of the lateral pterygoid muscle is related by the ramus of mandible, tendons of temporalis, masseter muscle, superficial head of medial pterygoid muscle, and the last one, that is the second part of maxillary artery. These are the relations of the lateral pterygoid muscle. The lateral pterygoid is the key muscle of infratemporal fossa. Due to its relations, it is the only muscles of mastication that opens the mouth by depressing the mandible. It is innervated into them by the mandibular nerve and it is inserted into the pterygoid fovea on the front of the neck of mandible. Its upper head is originating from the infratemporal surface and crest of greater sphenoid in the roof of the infratemporal fossa, and the lower head from the lateral surface of the lateral pterygoid plate of sphenoid that is in the medial wall of infratemporal fossa. So that's all about the lateral pterygoid muscle. The next one, medial pterygoid muscle. The medial pterygoid muscle is a quadrilateral muscle with two heads, a larger deeper head and a smaller superficial head embrace the lower head of the lateral pterygoid muscle. The medial pterygoid muscle origin. The deep head of the medial pterygoid muscle is arising from the medial surface of the lateral pterygoid plate and from the adjoining surface of the pyramidal process of palatine bone. The superficial head that is arising from the medial surface of the lateral pterygoid plate and from the superficial head is arising from the lateral surface of the pyramidal process of palatine bone and from the maxillary tuberosity. Then the insertion, the medial pterygoid that is a strong tendon into the roughened area on the medial surface of the ramus of mandible below the mylohyoid line, including the medial surface of angle of mandible. The next one, action of medial pterygoid muscle. The medial pterygoid muscle of both sides act to elevate the mandible, that causes the closure of mouth. The medial pterygoid and the lateral pterygoid of both sides act to protract the mandible. The medial and the lateral pterygoid muscle of the two sides contract alternately to produce side-to-side movement of mandible as in grinding or chewing of the food. Then nerve supply. The medial pterygoid is supplied by nerve to medial pterygoid that is arising from the trunk of mandibular nerve. The next one, relation. It have two relations, superficial and deep relation. The superficial surface of the medial pterygoid muscle that is related by the lingual nerve, inferior alveolar nerve, inferior alveolar vessels. The deeper part of the medial pterygoid that is related by the levator palatini and tensor palatini, superior constrictor, styloglossus and stylopharyngeus. The medial pterygoid has a two-head, superficial and deep. The superficial head is arising from the maxillary tuberosity and the deep head is arising from the medial surface of the lateral pterygoid plate. The medial pterygoid is inserted into the medial surface of the ramus of mandible. So that's all about the muscles of mastication. Then it is related by some of the clinical anatomy. In tetanus, there is a contraction of both masseter muscles which causes locked jaw, paralysis and wasting of temporalis that producing hollowing in the temple. Then the paralysis of masseter that causes the flattening of the angle of jaw and clenching of the teeth is not possible. The last one, paralysis of lateral pterygoid muscle that causes the jaw to deviate towards the paralyzed side on the opening of mouth because of the action of normal muscle. So that's all about the muscles of mastication.